Right now on Denver7 News at 5, restaurants on the chopping block.
It's scary. I'll look at it and there's just like 1 or 2 people walking around.
Indoor seating slashed, expensive equipment installed. For many, the math isn't adding up.
All indoor dining is closed, and yet again, nobody has a crystal ball to say how long this is going to last.
With no let-up in the coronavirus surge, many businesses wonder how much longer they can hang on.
From coast to coast, hospitals are slammed, families are struggling, and now leaders in Washington are scrambling to pass a second stimulus deal.
Failure is not an option. The Senate needs to pass a new relief package.
How the help is being carved up and how soon it could be approved.
And show your test results before you ski. Tough new coronavirus rules and a county packed with popular resorts.
And welcome to Denver7 News at 5. I'm Ann Trujillo.
And I'm Shannon Ogden. Glad you're with us tonight.
Today, a dire plea from Colorado restaurants. Indoor dining is shut down for many, and takeout is not filling the gap. Owners say the longer this closure, the harder it's going to be to survive, let alone recover.
Businesses are pinning their hopes on help from state and federal leaders. But as Denver7's Liz Gilardi reports tonight, many worry it could be too little, too late.
So we've now become a 5-table restaurant here.
This weekend is the first time these greenhouses will be used at Tavernetta. What used to be a 130-seat restaurant has been reduced to these 5 tables.
It doesn't work. It doesn't pan out. We're just in survival mode.
Every day it's becoming more difficult to survive. Restaurant owners we talked to say optimism has faded, and if they received any PPP money, it's long gone.
This past weekend was the slowest weekend we've ever had in our 15 years of being open.
Stephanie Bonin owns Duo Restaurant. She says the current climate feels a lot like March. She just laid off staff for the second time when indoor dining was suspended. She started an online petition asking for ongoing relief. It has more than 1.8 million signatures.
With my change.org petition, I'm asking for more. I'm asking for consistency.
The restaurant industry is battling restrictions that seem to be constantly changing. And when the last call was moved up again, it devastated business at High Point Creamery.
So my busiest hours of my business, which are from 7:30 till 10, have disappeared here.
With an entire industry on the brink, the Independent Restaurant Coalition is also pushing for immediate relief.
What we have seen in the study that we had, the economic study that we had done, is that maybe if there is not a package specifically for restaurants soon on a federal level, we're going to lose 80% of our restaurants in America.
And the worst part, there seems to be no end in sight.
We're exhausted. I mean, we've been playing pivot and catch up and innovating for 9 months now, and we're just tired. But on top of that, when you close this down again, and it's in winter, it's just it's such a scarier time for us.
Liz Gilardi, Denver7.
It is scary out there, and a new round of stimulus cannot come soon enough for struggling families. With signs of progress in Washington, we could see a draft agreement by Monday. And Colorado Democratic U.S. Senator Michael Bennet says the coronavirus surge is putting pressure on legislators to act.
There's an understanding on the part of the leadership, including, it seems, even McConnell, that we've got to do something. And that something is going to have to include preserving some form of the enhanced UI benefits, the unemployment benefits.
Okay, so what's in and what's out? CNN is reporting the deal will include a $300 per week boost to unemployment benefits. It would also extend the program allowing gig workers to file for unemployment. A pause on student loan payments and another round of money for the Paycheck Protection Program. Now, don't hold your breath for another $1,200 stimulus check. Republicans are battling to keep the total cost of the bill down, so that is unlikely to make a comeback.
Pandemic pressures forcing many businesses here and across the nation to pause hiring. The latest numbers from the Labor Department show companies added 245,000 new jobs last month, but that is a huge dip from the more than 600,000 added in October. The latest evidence that the surging coronavirus case numbers are hitting the economy very hard. There are new rules in Pitkin County that are going to mean big changes for skiers and snowboarders. Starting on the 14th, so that's a week from Monday, visitors will be asked to sign an affidavit stating they had a negative coronavirus test within the last 3 days and had no symptoms for the last 10. Pitkin is home to several popular ski resorts like Aspen Mountain, Snowmass, Buttermilk. County leaders say they will rely on public health staff, not the businesses, to check up on visitors.
We're not going to be asking our lodging community or such to look at test results or those sorts of things. It would be through our public health staff.
The rules apply to anyone coming overnight from outside Pitkin, Eagle, or Garfield counties.
And local businesses need our support now more than ever. And Boulder says it had an overwhelming show of support for its independent stores this month. Listen to this. The city launched a program called Boulder Bucks. They launched about a week ago, and the city sold gift cards, validated dozens of local stores, even matched some of the money that you loaded on them. Well, Boulder says it sold out in less than a week, with shoppers snapping up more than $250,000 worth of gift cards to spend in the city.
Financial struggles are really just part of the problem right now. The COVID tracking project says more than 100,000 Americans are in the hospital now because of the virus. And Dr. Anthony Fauci warns we have not yet seen the full surge in cases from Thanksgiving. If we stay on this path, the CDC warns 50,000 more Americans could die by Christmas. New research shows roughly half of new infections are spread by people who don't show symptoms. Public health doctors say wearing a mask is a critical tool right now.
All right, now checking coronavirus case numbers here in our state. Things are not where we want them to be. Colorado reported more than 5,000 new cases today, so our total now stands at more than 250,000. Another critical measure is the number of hospital beds in use because of the virus, and that stands right now at just below 1,900. And that number is close to the highest level ever reported in our state. And in Denver, Latinos are being affected by the illness at roughly double the expected rate. Centers for Disease Control and Prevention says within the city, Hispanic adults make up 55% of cases, 62% of hospitalizations, 51% of deaths, but they make up less than 25% of Denver's population. The CDC says Hispanic adults in Denver are more likely to be frontline workers or live in larger households, and that can increase the risk of catching and spreading the illness. Of course, we know the most powerful tool to end this pandemic is a safe and effective vaccine. Well, Moderna says its version is showing lasting protective effects months after people got the shot. Data published in the New England Journal of Medicine showed a strong immune system response 3 months after the second dose was given. Researchers say the Moderna vaccine is 94% effective, and the FDA could give emergency use authorization to Moderna this month. Of course, no vaccine is 100% effective, and that means doctors need powerful treatments to help coronavirus patients now and in the future. Denver7's Jessica Porter has more on a new drug being distributed by UC Health. It's intended to help patients most at risk. Jessica?
UC Health has a limited supply of just 650 doses of the experimental drug created by Eli Lilly. I spoke to a Denver man who believes the treatment kept him out of the hospital.
So initially, it really is just lost the sense of smell. And that was the first thing I noticed. On the 23rd, I woke up congested.
When William Stanton tested positive for COVID-19, he was already experiencing mild symptoms and knew he was high risk.
So I'm a diabetic. I also have asthma, and I also have high blood pressure.
A nurse recommended a new antibody drug called bamlanivimab.
Within hours of the transfusion being done, I could feel the congestion going away.
Doctors say it's not a cure, but is intended to reduce the severity of COVID-19, keeping high-risk patients out of the hospital.
So there's proteins that live on the surface of a virus that this will then latch onto. And the idea is that it'll keep the virus from its factory. It's basically trying to shut the factory down.
Bamlanivimab is given through an intravenous infusion in your arm. It's only being offered to patients within the first 10 days of infection who meet strict criteria.
And this is really intended for people that are feeling sick, not asymptomatic individuals, and have some other comorbidity that puts them at a higher risk for ending up in the hospitals.
It's still too early for doctors to determine how effective the drug is. Stanton believes the drug may have prevented him from getting seriously ill.
I mean, this is a scary thing. And like the nurse was telling me that, it could literally be within minutes. I go from feeling okay to feeling really bad, you know, and I feel fortunate to not have to have gone to experience that.
That drug is available at UC Health and multiple outpatient treatment centers. But remember, it will only be given to those with pre-existing conditions that put them at high risk. UC Health says because it's a treatment for COVID-19, most insurance plans should cover it. Jessica Porter, Denver7.
a unique way to connect to Colorado.
There's something about the mountains that just scream, God. And for me, that minimizes whatever issues that I might be going through.
Why this barefoot hiker says hitting our state's highest peaks helped him overcome a low point in his life.
Gorgeous weather for the Front Range today with temperatures around 60 degrees. Coming up, I'll let you know if this will last all weekend.